And you're going to hear, there you go. Now the recording is in progress, so we always like to remind people that welcome to Independence Amplified Maryland, and we are recording this episode. We do post them in Image Center's YouTube library, I guess is the right term, and so you can always go back and listen to these again or see shows that you missed if there's something that you were hoping. I'm Sarah Basehart, and I'm the Executive Director at Independence Now, and we are the Center for Independent Living that serves Montgomery and Prince George's counties, and I'm happy to welcome you this afternoon to a show that we called, Are You Taking Care of Yourself? I'm not sure it was quite the right title, but it was what we came up with. So we have two speakers today, and I'm going to introduce both of them, and Debbie's going to speak first, and then Dionne. And in mid-show, I'm going to leave because I now have to pick up kids in the middle of this show, and Mike Bullis will take over for the end of the show for me to manage things. So we want to remind folks that we keep everybody muted during these shows to make sure that everyone can hear the speakers. You are welcome to put questions in the chat during that time, or you're welcome to verbally ask those questions when we take a break at the end of each speaker, and either Mike or I will sort of manage that, and Amanda will let us know if we're doing something wrong or have forgotten someone. So I'm gonna just get going introducing folks. So we have, I'll introduce both of you so that you can each speak in case I'm not here when Dionne starts. So Debbie Feierman is from CMS. She actually works out of the Philadelphia office, if I remember correctly, the Office of Program Operations and Local Engagement, and that is our local office for CMS. And she is going to speak today on it's that time of year again for Medicare Open Enrollment. So she's going to speak a little bit about that and give some information about flu shots this year and how important it is to remember to do those. We've been very focused on other vaccines recently. So that's going to be Debbie. And then, oops, one moment, sorry, I lost, there we go. And then Dionne Haney is from SkyGen, which is the organization that administers some of the Maryland Department of, or administers the Maryland Department of Health's dental program. Back in 2019, they began administering the Maryland Department of Health's adult dental pilot program that covers adults aged 21 to 64, and that's for both people using Medicaid and Medicare. She'll get into far more details. I will mention that she also oversees and has information on the Maryland Healthy Smiles dental program, which tends to be for children and for other more specific populations of people. So I've asked her today to talk more broadly about the adult dental program, since that's typically what most folks on here would want to know about. So, all right, we're going to start right off with Debbie. Thank you for being here.
Oh, thank you. Thanks for having me, Sarah, making it possible. And thanks everybody for a little bit of your time today. As Sarah said, I'm Debbie Feierman. I'm with the Centers for Medicare and Medicaid Services. And specifically, I'm the point of contact for local outreach for Maryland and DC. So I put my email address in the chat. Should you have any problems or questions or need some guidance or direction with regard to Medicare, Medicaid. I can also, we have a Medicaid unit, of course, in our agency. And so I'm always happy to, connect issues with Medicaid that you may be having to our state person in our office for Medicaid. And we also oversee the marketplace, which I'm sure you'll be hearing about, come November, because they too will have an open enrollment period. But right now, I just want to take a couple of minutes of your time to let you know about the Medicare Open Enrollment period, because it is a special time. And I'm gonna share my screen if I can. Let me know. So, can you see that?
Yes, we can.
Okay, great. All right. So I am going to, there you go. As I said, and in this slide, I will make the slides available to Sarah because there are some links and there are some contact for further information. So at the end of this, I'm happy to share it with Sarah, so you don't have to feverishly write. So open enrollment period comes every year, and no different this year. It runs from October 15th through December 7th. And this is the time of year that we encourage all folks who have Medicare, and they can be dually eligible, certainly, but anybody who receives Medicare benefits, to make sure that the plan that they're on continues to work for them, that they review what their options are and look and see if they want to make any changes for the coming year. The types of changes that people can make. If a person's in original Medicare, they may elect to join a Medicare Advantage plan, which is your health and drug plan all wrapped in one. Some folks, you can switch your Part D plan. So the company that you get your prescription drugs from, you can make a change for calendar year 2022. You can switch from original Medicare to Medicare Advantage, or switch back from Medicare Advantage. If you're not happy with your Advantage plan, you can switch back to original Medicare. And those changes that you make during that October 15th through December 7th, they take effect January 1st of the following year. When people are considering and reviewing what their options are, we make certain recommendations that they should consider while they're reviewing their options. They should think about who are their healthcare providers, because if folks are very happy with their docs and they want to stay with them, you need to make sure that your docs are in the plan that you're looking to work with. The same with pharmacies. The pharmacies that you are comfortable with or are servicing you for your medications, make sure they're in the plan that you're thinking about. If there are additional benefits, so some folks need, some plans offer additional benefits like dental and vision and hearing that are not Medicare covered benefits. Those, if that's important to you, then make sure and see if it's covered. Of course, we always tell you to look at the costs. What are the costs for your premiums, your deductibles, and then your cost sharing? Cost sharing is what you're going to pay at the counter each time you pick up a prescription, or what you're going to pay when you see your primary care doctor or a specialist. It's also important to consider the quality of customer service. And I do encourage people, if you're thinking about a plan, it does help to pick up the phone and call the plan, see if you like the kinds of service, the kind of service that you get when you call their customer service line. But these are just some points to consider. Even if you are happy with the coverage that you have, everything can change. You know, these are calendar year choices. So things can change from 2021 to 2022. Even if you're happy, look and see what your options are and review to make sure if you want to stay in that plan. Information about Medicare Open Enrollment and the coming year, what benefits and what the coverages are, you'll find them in this Medicare and You Handbook, which is sent to the households of individuals, usually by September 30th. So by October 1st, it's one per household. Folks should have gotten them. If they didn't, they can call 1-800-Medicare and request a copy. I also want to point out this Medicare and You Handbook is available in large print, in Braille, and this year, for the first time, it's available in Chinese, Korean, and Vietnamese, in addition to English and Spanish. So, you know, people can specify their preference. What to review? Each year, plans are required to notify their customers of changes coming in the coming year. So if there's been a change in the cost or the benefits or the drug formulary or the networks, the plans are required to notify their consumers in this, what we call an annual notice of change. And they usually have to be received by October 1st. I will say that some of the plans incorporate that annual notice with a bunch of other marketing material. And so it may not come in its own individual, envelope that would be obvious to somebody, but plans are required to notify and let folks know what changes are coming in the coming year. And so with all of that, and this is Medicare Advantage, it's, things to think about in the Medicare Advantage. It's not that different from what I've already described. Think about your costs, your premium, your out-of-pocket maximum. So in Medicare Advantage, there's usually a cap on the out-of-pocket, whereas in traditional original Medicare, there is not a maximum amount. It just keeps going. But also in Medicare Advantage, there are service areas. What this means is a plan has designated an area that their networks can support. So you have to make sure that you live in the plan service area and that, as I said, your doctors, your hospitals, your pharmacies are part of that. Check and see if there are additional offerings by the plan that perhaps are not Medicare covered. There are some plans are now allowed to offer what we call non-primary health related benefits for people with chronic illness. And these are usually things that are social determinants of health. So for instance, transportation, meals, things that might interfere with an individual's ability to access their health care. Plans are now allowed to offer it for those who have chronic illnesses. So that's something that happened, I think, last year. And also I want to point out that plans are rated. There's a star rating from 1 to 5, 5 being, the top, the best, and 1 being probably the least favorable. And the star ratings are on this plan finder. So we do have on Medicare.gov a comparison tool. And for folks who have Medicare.gov accounts, they can go into their account and indicate they want to compare plans. It will automatically populate with their drugs that they have that they had filled at a pharmacy. Our records obviously will already show their Medicare number, their address, their medications. There's a claims history in them. So if a person goes to Medicare.gov and has an account, they can get a personalized search based on their medications. If they don't, they can create an account and somebody can help them do that, or they can do a generalized search. There is the ability to do a general search. It's just not as specific as the personalized search, but it can be done. And what you do is you indicate what medications you're taking, the dosage and the frequency. And it will look for all the plans that are available that cover your drugs in your zip code. And it will compare up to 3 plans side by side. So you can see what the premium is, what the deductible is, and what the cost for your specific medications will be at the pharmacy that you designate that you work with. Now, Medicare.gov, I think it's a much improved tool. It's fairly intuitive, but we do have people throughout the state of Maryland who can help people do these personalized searches. And I have a slide in here with that information as well. But I also want to point out Medicare, 1-800-Medicare also has customer service reps who can do a personalized search for you based on the medications. So if you are working with somebody who's having a hard time or doesn't like their plan or wants to see if they can get something cheaper, if they call 1-800-Medicare and say, I'd like to have a customer service representative help me do a search, they can do that for you. You should just make sure that you have your Medicare number, your beneficiary number. They're going to ask you the effective date of your Medicare, which is on your Medicare card. And they're going to ask you your medications and your dosage and your frequency. So those are some, and when you call, you should have that information available and they can help you do a search and explain to you what your options are. So while it is open enrollment season and there's lots of opportunity to do lots of shopping, unfortunately, there's also opportunity for fraud. And we know that this is the time of year where we see probably the most fraudulent activity, with people receiving phone calls and getting things in the mail that are asking for information that they should not be giving. Medicare will never call a representative, and they will not ask you for your Medicare number. We already have your Medicare number. So it's really important to let your clients know that there is a higher risk during this time of some fraudulent activity. And, there are things that plans can and cannot do when they market. For instance, they are allowed to send emails, but they are not allowed to call you or visit you in person to market, your products. If you ask them for help, they're allowed to call you, but they can't just, show up at your door and try and do some marketing for you. So really important. They also, if they send you emails, there has to be an opt-out option. So people need to be aware when they are sharing their information. If, on the other hand, you're calling 1-800-Medicare and they ask you, what's your Medicare ID, in order to help facilitate a search, that's legitimate, right? Because you're calling them and you're asking them for help. So I just want to make people aware. So we do.
Can I pause you for two quick questions, Debbie?
Yeah, sure.
Okay. So the first question is, when you call the 1-800 Medicare number, can you get the booklet guide in alternative formats by calling that number, or do you have to call a different number?
Terrific question. No, you call 1-800 for everything. 1-800 Medicare 24/7. And you can tell them that your preference, you need Braille. And what they're going to do is they're going to indicate in your record that you need large print or Braille or another language, that's your preference. And so then all your materials will come that way.
Okay. And thank you. And the second question is, are you guaranteed the ability to change plans, or do you require a medical exam?
For changing during open enrollment period, everybody's able to make a change. So it does not require. We have certain enrollment periods. One of them is open enrollment period. And that's when everybody gets to revisit the choices that they made and make a change if they want to for 2022 or the following year. They don't have to, but they should at least review to make sure that their doctors are still in the network, that all those things that are important to them, their pharmacy and things like that. But it does not require for Medicare, it does not require an exam. Good questions, thanks. So free assistance is available. We work very closely with the State Department of Aging. So you'll find information on Maryland State Department of Aging about open enrollment, but they also have in each local county Department of Aging, they have what they call assisters, SHIP counselors for state health information and assistance. And those counselors are available usually, well, this year, I believe all of them are doing virtual. Some of them are doing in person, not all of them. But every Department of Aging, the 800 number that you see listed here is the state phone number. They're probably going to farm you out to your local county, the county in which the person lives in. And you'll see on their website, this slide I just created from their website, it lists all the phone numbers for each county's Department of Aging. So if you're in Kent County, just go to Kent County Department of Aging. You should see something there, and you can call them and try and request an appointment for somebody to talk to a trained counselor. So we work and we train them. But I also want to point out here, I have open enrollment social media, and I put it in the chat also. So we have a lot of material. We have videos, we have, Facebook, Twitter, social media. And we're asking partners, if you have a website, if you have a Facebook account, could you just go there, grab one of the videos or one of the Facebook things and put it on? Let me know that you've done it, because we are feeding back to our managers, our senior management, what partners are trying to do to help message, and how many people, you might reach. Or how many people visit your website, or how many viewers are for your social media activity, so that we can adequately represent the work that many of the partners do. But it's all there prepared. It's in different languages as well. And so I also want to point out that this year, and every year actually, Medicare does cover a flu shot, one per flu season. You don't pay anything for it. In fact, most of the commercial insurers as well, for Medicare, Medicaid, Marketplace, it's considered a preventive health care benefit. And we really, really need to encourage people this year to get flu shots. Last year, everybody was, pretty much quarantined and not out doing much. And so this year there is some concern that the flu season will be pretty robust. So we want to make sure everybody, 6 months and older, gets their flu shot. Whether they're an original Medicare or Medicare Advantage, it is covered. There's no cost sharing available. And also that people should consider if they're eligible for their COVID boosters. We do have a lot of multilingual fact sheets. You can take them if you have a newsletter. You can just drop it in a newsletter. We have a social media toolkit. We have graphics, drop-in articles, flyers. If people are doing flu clinics, or the Department of Health is coming to do flu, you can just go in there and grab a flyer and put the date and time that your flu clinic is coming and print it out, and it's available for you to use. So I put that also in the chat so you can see what kind of material is there. We really appreciate you helping get that information out. I will be happy to take any questions and concerns, and my email address is here, and I also put it in the chat. And also, because we want our information to be relevant and helpful to you, this QR code or this email, this web link right here, we have like I think it's 4 questions, so that we can make sure the information we share with you is relevant, helpful. If you can just take your phone camera and click on the QR code, it will take you right to those 4 questions. Otherwise, you can use the link here. And I think that is it for me. Happy to take any questions.
It looks like Bong has a question. If Amanda can unmute. There we go.
Sure.
I got it. Hi, Debbie. Thank you for the presentation. It was really nice. I just have a question as far as the latter part of your presentation, because there's a lot of rumors, or some people may think, that it could be bad. As far as the flu shot, and then for people who are eligible for their boosters, is there anything saying that you shouldn't or should or could or couldn't do both of them around the same time or even at the same time?
Excellent question. So if you go on the CDC website, and I'm happy to go there and put the link in there for you, I believe CDC recommends that you can, their guidance, I shouldn't say they recommend, their guidance, CDC guidance, who is the federal agency that would make those recommendations based on the medical findings. And they did, their guidance does say that you can get them at the same time. As far as paying for it, which is what my agency does, our agency will pay for both shots to be administered at the same time. We have guidance for any provider that bills for flu and or for COVID on how to bill for each of those shots, so they can get an administrative fee for administering both of those shots. So providers can get paid for both of those. And the CDC guidance does say that they can get them done at the same time. The specification for a time lapse really has to do with when you got your initial or primary series and then your booster. So not with flu and booster, but with your primary COVID vaccination and your booster vaccination. There is a specification of time.
So I have a follow-up
you.
question with that. There are other vaccines that pharmacists can give, like tetanus boosters, pneumonia, shingles, whatever, depending on how old you are. Is there anything that you are not allowed to combine and get paid for?
Yeah, so that would be a question that you need to discuss with your primary care physician and or the pharmacist administering them.
I have a question.
Thank you.
Sure.
Okay.
Yeah,
All right. One more question, and then I'm going to remind Mike he needs to come back on screen and manage things so I can hop off.
Yes.
Thanks
Debbie,
again, Sarah, before
Thank
we
you.
Yes. And see, I also have Medicare too, and also, but could it be the same thing also with other shots too, like other COVID shots? Because my mom works for CMS in Woodlawn here in Maryland.
Great.
And so
And what's
is it like a discount with some of them and with some other providers like Summit Medical Care Group? Have you ever heard of them?
Are you asking if there's a discount for the cost of the shot of COVID shot vaccination or flu?
Yeah, that, and also plus because I got a letter in the mail also about, with my medical provider, with my physician that I go to.
Yeah, there is no charge for flu or for COVID. I mean, if you're going to a Medicare provider, you should not be paying out of pocket for the flu. If you're getting some other service during that time, you might have to pay for whatever that cost share is of the service. So for instance, if you were going for your annual physical or because you needed, your A1C tested for diabetes and you got a flu shot, you would have to pay your copay for that diabetic visit or annual physical, but not for the flu or for COVID.
We have one more question in the chat as well.
Sure.
I'll just read it out loud. It says, I am not sure if this is relevant to this session, but my son has Medicaid from Maryland through SSI. And then later it said, sorry, I meant Medicare. I'm told that since I, as his mom, have had Medicare for 3 years, that he will be eligible for SSI soon. Is this correct?
Okay, so the SSI determination is the Social Security Administration. Are they saying he would be eligible for SSI payment or for Medicare? He already has Medicare?
I'm not sure. I believe it's Raya.
I'm going to ask for an individual situation. If Raya or whoever it is wants to either email me or call me, I'll take that information and we have to look at the specific record. Okay, and Sarah has my phone number, but I'm happy to leave it in the chat also, and I'll put my email address in there again for anyone that has a specific concern.
Thank you. We also
Yeah,
have another
sure.
response in the chat for that, Raya. So if you just want to read that, that might be useful as well.
Great. Nothing else for me.
Okay, great. This is Amanda from the Image Center. Are we ready to move on to Dionne?
I think so.
Good afternoon, everyone. This is Dionne Haney. I am the manager of member experience for the Maryland Healthy Smiles program, and I'm delighted to be here with you today. I can't tell you how amused I was with regards to the different shows everyone is watching, but I do have a connection to Beverly Hills, Housewives of Beverly Hills. I actually went to school with one of them. My brother actually graduated with one of them, and all I can say is she did not look like that in high school. So that's all I have to say about that one. And then with regards to the flu shot and COVID-19 at the same time, I can tell you from personal experience My father just did that a couple weeks ago. He got the flu shot in the left arm, the COVID-19 on the right arm, and he is happy-go-lucky because feels very safe about his actions and what he has done moving forward with his health. So with that, I'm just going to go ahead and get right into this part of the presentation. As I said, that I am the Member Experience Manager for the Maryland Healthy Smiles program. I'm going to cover different parts of the program. Some may affect you directly, some may not. Perhaps you know others that should know about this information. So please share the contact information at the end of this presentation with those that you think should be a part of this knowledge. So the Maryland Healthy Smiles dental program covers the dental benefits or services for Medicaid members in Maryland. The Maryland program covers children under the age of 20, pregnant women who are 21 and older, adults with rare, expensive medical treatments that are 21 or older. We also assist dental benefits for former foster care members who are between the ages of 21 and 25. And then we do have the new pilot that's been in production for almost 2 years, where we offer dental benefits to adults ages 25 through 64 who are both eligible for Medicaid and Medicare both. So I actually work for a company called SkyGen. We're the dental administrator for the program. We do have a direct customer service phone number. That number is 1-855-934-9812. And that will also be in the chat at the end of this presentation, as well as on a slide at the end. Let me just go back here for a moment. So through the customer service line, we can help you find a dentist close to your home or to work. We can assist you in making dental appointments to the dental office. If you don't have transportation, we can help you find transportation to get to the dental office. We can provide basic dental information like what benefits are covered, what claims you have submitted or your dental provider has submitted. We can assist you in replacing your lost member ID card to ensure that you have that in hand when you go to the dental office. We can also assist you in using our website, which is www.member.mdhealthysmiles.com. And then we can also assist you with getting help with or special needs for different languages or materials. If you are dissatisfied with a treatment or a dental office that you've recently been to, we can help file a complaint for you, as well as if you go to the dentist, you get a covered service or need a covered service and it's been denied, we can help you appeal that to see about getting that service covered in the future. So in order to provide the best information for you, we always ask that you update your personal information with the Maryland Health Connections office. That's very important because that's where we get our information on you. So if you have a new phone number, if you have a new address, anything like that, or if you have a new birth in your family, it's important for you to contact the Maryland Health Connections phone number at 1-855-642-8572. Again, Maryland Health Connections phone number is 1-855-642-8572. Like I said previously, if you call the 800 number for customer service for Maryland, we can get you a ID card sent to you, as well as a new member handbook. Maryland Healthy Smiles members are able to see any dental provider that you wish to see, as long as they enrolled in the dental program. And then you also have the ability to change your dental home. Generally, when you receive dental benefits from Maryland Healthy Smiles, regardless of your age, we assign a dental home to you in hopes that you will contact that provider. If you don't wish to use that dental home, you can basically use any dental provider in the state as long as they are enrolled in the program. And we just want to keep reminding folks that as long as you continue to go to a dental office on a regular basis, you tend to have better oral health care and less use of an emergency room or emergency services in the dental office. So again, keep those dental appointments. They're important to your good oral health. Regular dental appointments should occur every 6 months. If you're unable to keep a dental appointment, we ask that you contact your dental provider as soon as possible so that you can let them know that you may not make it to the dental office and that you can reschedule for the next available time. Sometimes if a member misses too many appointments, the provider may dismiss you as a patient, and we don't want to see that happen. So again, if you think you're going to miss a dental appointment, please reschedule at your earliest convenience. And again, if you need transportation, because we do know that causes problems in getting to the dental office, we can assist you at the customer service phone number, or you can contact your local health department. There are some dental services that are not covered in the Maryland Healthy Smiles program, but basically any covered service in the dental program, your dentist should not be charging you for any of those services. But if you find that a service is not covered, the dental provider should be informing you of that and then having you complete a non-covered services agreement. So the non-covered service agreement should include all the dental codes or the dental services that the dentist believes that you should receive, but you will be the responsible party to pay for those services. I think I'll stop right there to see if there's any questions in the chat. Let me check for that. I think everybody's doing okay. Okay. So there are dental services for pregnant women. Women eligible for Maryland Medicaid benefits qualify for these dental services while they're pregnant, and soon, even after postpartum. That has not gone to effect yet. We're hoping to see that go into effect hopefully by January. And when that goes into effect, not only will the pregnant woman have dental benefits up to the date of delivery, but then 2 months after the date of delivery, which is very exciting because, of course, in that third trimester, some pregnant women are not feeling comfortable to go to the dentist, so then they can get their dental services right after the birth. Some of the covered services for pregnant adults include checkups, cleanings, fluoride treatments, x-rays, fillings, root canals, crowns, extractions, and denture adjustments. Dental providers are responsible for asking women if they're pregnant, and then the dental provider will submit a claim or authorization for you. The dental office does have to use certain codes, so it's the dental office's responsibility to submit the correct information. Now I'm talking about the Maryland Healthy Smiles adult program that went into effect in late 2019. This dental program covers adults that are aged 21 through 64 that are eligible for both Medicaid and Medicare, but are not enrolled in a managed care organization. Adults in those age brackets can receive dental services up to $800 a year. That annual benefit allowance resets at the beginning of the next calendar year. So if you're close to the $800 maximum in November, you'll get a new $800 available to you in January. If you use all your annual maximum within that year, then you would be responsible for those additional services outside of that $800 amount, and you would be required to sign a non-covered service agreement with the dental office. But even then, the provider may only ask you to pay up to the Medicaid rate of reimbursement that you would have normally received if you were still covered under that program. So again, for the adult dental pilot program, the provider and the member actually needs to discuss the treatment that you're going to receive. And then as the adult or a dependent taking care of that adult, you need to sign off on that global treatment plan. So some of the covered dental services for adults can include cleanings, an actual exam, x-ray, fillings, and then extractions as well. So again, the contact information for the Maryland Healthy Smiles program, you can contact customer service at 855-934-9812. And then we do have a separate phone line for your dental provider. You can get that from customer service if your dental provider doesn't already have that. And then again, the website you can go to is www.member.mdhealthysmiles.com.
Okay, I think we had a question. Cheryl Grossman, were you trying to, did you have a question?
Wrong Cheryl, but yeah.
Oh, wrong Cheryl, sorry.
We get confused all the time. It's fine. So I know at least for non-dental appointments that Medicaid will not cover transportation if you're paratransit eligible. And they also have a limit for how far they'll take you. Like I wanted to go from Baltimore County to PG County, they wouldn't do it. So I was just wondering if there were any limitations on transportation for dental.
From my understanding, and I can get clarity for you and get back to you on this, but my understanding, as long as you are still eligible for dental services and you are connecting with a transportation service, they should be still assisting you with that transportation. And if not, that is something that we need to look into and get assistance for you in the future.
I have a question. How is the program going? In other words, there was always a big fear that if you opened it up from 25 to 65, millions of people would suddenly appear and the program couldn't afford it. How many people have enrolled and how are the costs? I assume somebody's looking at costs and asking good questions. Any reactions to all that?
Yeah, thank you for that question. I believe in the annual budget for Maryland, they're looking to spend approximately $35 million a year, or maybe, don't quote me on that, I should probably verify that, maybe less than that. I don't see that they are getting anywhere close to what they had envisioned in that expenditure line. We are not seeing the crazy increase that we thought we would. We're trying to reach out to all the different organizations, and that's why I'm connected with Sarah to discuss this today, because we truly feel that not all the members know that they have dental benefits. Right. And so we do postcard mailings to that population twice a year, and it has on that postcard what their benefits are, and the phone number to contact to get information. But unfortunately, I think in 2020, which was a difficult year for everyone, we knew it wasn't going to be a high utilization year. We only had 400 adults that actually maxed out at the 800 when we have 35,000 eligible. Yeah. So yes, we are very disappointed that we're not seeing the utilization that we were hoping for. 2021, it's picked up a little bit, but we truly believe that there's hesitancy on the members' part in going back into the dental offices. Yep. And quite frankly, some of the dental offices haven't reopened with a full staff. So we are trying our best to get everyone out there to get their dental benefits. So that's a great question, Mike. Thank you.
Sure. Well, hopefully the word will get out and people will spread the word that it's available. It has never been available in our lifetimes. So, it's one of those things that's always just been understood. You don't get dental from Medicaid, bang, done, Tom, no discussion. So it's going to take a while probably to sort of flip that narrative. So, but thanks for getting it out there, and we'll keep that in mind as we provide information at our centers as well. Any other questions?
Yes.
Okay, hang on, Chi. Okay, I thought there was somebody else first. Maybe I just misheard. Go ahead, Chi. Okay, what's your question? Is this about dental? Okay.
Yeah, that and also for Debbie too, also.
Now Debbie's not here, I don't think so. But anyway, go ahead. What's your question about dental care?
Yes. And
I'm still here.
Oh,
Debbie,
right.
hold on. For Debbie, do you have any in sign language? Hello? Do you have any like stuff in sign language since you said Braille?
We do have interpreter language, but for our publications, is that what you're asking?
Yeah, for like deaf people.
There are recordings of some things, so it would depend on what you needed. But you could ask 1-800-Medicare. They can try and access that material for anybody that needs it.
Okay. Thank you. All right, for the deaf, yeah. With Dionne, are you familiar with Innovation Dental or with Dental One? Because I think they work with Healthy Smiles of Maryland.
I apologize, I'm not familiar with all the dental providers in Maryland. We have 1,600 dentists that participate in the program. So to know specific locations and dental offices, I unfortunately do not. But if you call the 1-800 number or visit their website, they'll be able to tell you for sure if that particular provider or location participates in the Maryland Healthy Smiles program.
Okay, because I did see that on Innovation Dental. They're located in Baltimore City and on Park Avenue.
Good, good.
Okay, other questions?
Michael, can I ask a quick question?
Sure,
Pauletta.
fire away. Fine.
Yeah, Dionne, my daughter receives medical services. She's in the, dental services. She's in the REM program. I've never signed up for the Healthy Smiles program, but is that who we're getting services through? Healthy Smiles. I get notices, but I've never signed up because I said, well, we have dental services. I don't need Healthy Smiles. Am I getting it?
Yes, you would automatically, as soon as you enroll through the Maryland Health Connections and they have your information, that information is automatically fed to my company to reach out to you for those dental services. So she would be eligible, and you don't actually have to sign up for Maryland Healthy Smiles. As long as she's eligible, she's automatically in the system.
Okay. Thank you.
Thank you.
All right, other questions? So just as a curiosity, I know now that maybe this still happens on Zoom calls, but are you always kind of, when you give a speech to everybody about Healthy Smiles and the importance of keeping your teeth clean, do people ever come up and talk to you with their mouth kind of closed because they don't want you to see their smile?
Yes, they do. And there's nothing to be ashamed about that, because that's what we're there for. We're there to assist and help. So yes,
Sure.
We do have quite a few individuals that are embarrassed to ask for help, and you shouldn't be, but yes.
Yeah. All right. Any other questions,
Call
folks?
to me, please. In the box, please, Dionne.
Yes,
Thank you.
thank you.
Did you go to school with?
Well, I want to thank you
I can't
both.
tell you that.
No, sorry. You got to stick to the questions, okay? All right, folks, listen, we're coming up on the end of the show here. Let's see if we have any more questions about these two programs. And I finally found out what OPOL stands for. I want to thank you all for that. I get Debbie, I get your emails all the time. And my speech pronounces your name Feierman, which I think is hilarious. But it also always references this OPOL thing. And I confess I had no idea what OPOL was. So
Yeah. It's external affairs, and we're talking heads, but our intent really is to talk to the people in the community who work with our consumers. You know what they need, and you can represent their concerns to us. So thank you.
Thank you. Well, no, and thank you very much. It's a real pleasure to finally get a chance to meet you, and now I can put a voice to the emails, and that's nice. So, All right. Any other questions before we close out today's program? I want to thank you both very much for coming in and presenting today and getting information out. This is going to be up on YouTube in a couple of days, so you'll be famous. There will be people flocking from the world to come and see you. You can tell all your friends that you're live and on YouTube, or no, you're not live and on YouTube, but there you go.
Mike, what's the chat? What YouTube channel is it?
It's the Image Center YouTube channel. Did you register today?
No, Sarah
You should
just
get
sent me
it.
something.
Oh, did she? I will, because I think I have your email address. I will send you the YouTube channel link.
Thanks
for
so
that.
much.
Yeah,
Great,
sure.
thank you.
Yeah, yeah. Thanks, everybody, for being here today.
Can I
As
have
always,
some, announcements?
Chioke, go ahead.
The autism walk is going to be this week, next Sunday.
Okay, well,
Live and virtual.
all right, now if you hang on a second, Chioke, we're going to do announcements, okay? So just stand by. Does anybody have events or announcements or group meetings or activities or things that you're doing these days that you want to tell us about? Chioke, this is your big chance.
Autism walk.
Okay,
It's
autism.
gonna be this what is it, next Sunday in Towson. It's gonna be live and virtual.
Excellent. Thank you very much. Any other announcements of activities or events or people looking for employees or you name it? You lost your dog and you're wondering where it went. Your cat got out. Yeah. All right. Okay. Hearing no other announcements, I want to once again remind you that these programs are brought to you by Centers for Independent Living. We can't do this without you, folks. We can't do that without the money it takes to hire the staff and keep the rent paid and the bills paid and all that stuff. So anything you can do to assist with these programs is much appreciated. Go and when you finish up here today, you'll get a response for your registration. Go ahead and click on look, $2, $5. We know that a lot of our users are very, very, very income limited. We get that. We also know that if we don't do it ourselves, if we don't care enough about our own disability movement, we can't expect others to do it. So give if you can, and thank you very, very much from the bottom of my heart for that. I want to thank everybody today for coming to this I Am broadcast, Independence Amplified Maryland, a broadcast of Centers for Independent Living in Maryland. Thank you all and have a good afternoon.
Bye.
Bye, folks. Thank you.